Hello and welcome to a special Blue November episode of Medical Talk, where we shed light on the health topics that matters most, especially for men. November is known worldwide as Blue November, a month dedicated to raising awareness about men's health, from preventive checkups to early detection of diseases that too often go unnoticed. Among these conditions, prostate health stands out as one of the most important, not only because prostate disease are common, but because early detection can truly save lives. Yet many men hesitate to talk about it out of fear, embarrassment, or simply the belief that it won't happen to me. Tonight, we will learn what the prostate actually does, how its problems appears, and how modern medicine, from simple tests to advanced treatment, is helping men live healthier, more confident lives. Joining us to discuss this important topic is Dr. Ali Mehdizadeh, a consultant urologist. You're watching Medical Talk. Stay tuned. Welcome back. We're happy to have with us in the studio Dr. Ali Mehdizadeh, a consultant urologist. Dr. Ali, welcome back to Medical Talk.
Thank you for inviting me. I'm very glad to be here.
It's always a pleasure to have you here. We are in a very special month, the month of November, which is known as Blue November, a global campaign for males. Health awareness. Why is it important to highlight it, not just this month, but I would assume that throughout the entire year?
Yes. I mean, in the recent decade, the WHO recognized that some diagnoses are getting more and more and is more important for the world issues, health issues. One of them is the prostate enlargement and prostate cancer. As we know, the prostate cancer and prostate enlargement and everything related to prostate of the man is making a huge difference in their attitude, their workflow, their capability, financially, economic-wise, in the countries, different countries. I will come to that to explain exactly. But to give you a small statistic, every year we have more than 110 million new case of BPH, prostate hyperplasia.
That's quite significant.
Exactly, or prostate enlargement in very easy sense, which has some mixing difficulties for the males. Normally, men's after 45, 50, when they're still young and become a little bit older, so we have to be careful which terminology with which they are not old people, but they're transforming from a very young guy to be an adult, more mature.
Yeah.
So in this phase, the prostate will be enlarged by 50% of men's, at least. So you are talking in different levels that a man could have mixtionary problem, waking up during the night 1 or 2 times to void, and that maybe affect his capability at his work, his planning, and etc. So beside that, we have more than 1.5 million new prostate cancer, which can be treated in different way. The best thing is to diagnose it in very early stage. That's why the World Health Organization decided in November, they make a huge campaign worldwide just to focus on men's health.
Absolutely. So now, you mentioned the prostate cancer. I think it's important to explain to our viewers the function of the males, the prostate in males, because there is always a misconception about the importance or the functionality of the prostate. So could you explain to our viewers what's the function of the prostate?
Prostate is...
It's a gland.
It's a gland.
Yeah.
It's a gland which has a secretion of a liquid which come with semen during an sexual intercourse. So the prostate gland has a very important role to play because that's the energy, that's the main source that makes a sperm move and can fertile a man.
Yeah.
So a man without prostate cannot be fertile. Okay.
Yeah.
He becomes infertile.
Exactly, because
So
he's missing
the important part, this liquid, which gives the sperms the ability to move and to fertile and female egg.
Yeah.
So with this taking in consideration, so any problem for the prostate, any kind of chronic inflammation, prostatitis, bacterial infection, which takes very long time, okay, it might make a young man infertile, okay? It might have a lot of urinary problems, which annoy the psychology of man. If a man every 1 hour has to go and void in the bathroom, cannot concentrate in his work, family, etc.
Yeah.
So it's something the mixture will annoy a person in the level I see a lot in my clinic, that the person comes and say, believe me, I can't focus, I can't work, I can't do my job properly, okay? Everything due to that I have always to think, where is the bathroom? Look for the sign of bathroom. I have to plan everything before, during, and after what I do, okay? So after certain time, this person become annoyed, okay, of this issue, which is mostly due to prostate either infection or enlargement or cancer or whatever.
So basically, it does affect their quality of life.
Quality of life.
Absolutely.
It's,
And it is a very important factor. Now, you mentioned age very briefly. How many people assume that prostate problems only happens for like elderly men. Can young men be affected with it as well?
Yes.
How early? How young?
How young?
Yeah.
I think one of the issues which we are seeing in the last 25 years, when I started my clinic here in Kuwait, I was seeing the prostatitis, very few cases. Now, every day, unfortunately, I'm seeing a lot of young people with having a prostatitis symptoms, and it's getting younger and younger. So it means that the prostate issues, problems, you can differentiate in different levels. One is for the young people below age of 40, which mostly we are talking about prostatitis and prostatitis symptoms. Then you have a slight enlargement between 40 to 60, that the person has a slight enlargement of prostate gland, which is nothing serious, a little bit can be annoying. Above the 60, it's very important that the person checks his prostate very regularly, because now the possibility of prostate cancer increase with the age. And suddenly 60 above, we see just randomized somebody which had no sign of any cancer, suddenly the PSA, prostatic antigen, is high in the blood, and then we have to take biopsies and etc.
So there's a great association between the age of 60 and above.
Yes.
So we need, and it's done with many investigations like blood tests, as you mentioned.
Exactly. We start with the blood test, urine test, ultrasound, and then if all proves that there is a sign of to be a cancer, then we go for prostate biopsy, and after that, it depends if it is positive or not. If it is positive, then there are different way of treatments.
Absolutely. Now, part of our conversation, you mentioned about the enlargement of the prostate. What is considered the normal size of the prostate, and when do we start talking about prostate enlargement? Basically,
the prostate gland is 20 grams. Is around 20 grams.
Okay.
Is the size of a small lemon.
Yeah.
And normally when it's enlarged, we are talking about something double of the size, 30 to 40 grams. So that's a relatively slight enlargement with some urine flow reduceness, and so on, some issues. But if the prostate gland is more than double, we are talking about more than 50 grams, 50 and above, and sometimes it reaches to 80, 100, above 100 grams. Here you are talking a very big mass, which really the urethra goes exactly in the middle.
Okay.
So you have a mass which squeezing the urethra. So the urine flow becomes so difficult to push the urine. The flow becomes very weak, and the person has to stand or sit for a very long time that he can pass urine, and he cannot empty the bladder. So he empties a part of the urine and keeps and keep going. And most of these people that during the night, as soon as they lay down, they have to go every hour.
Yeah, you get the urge to go basically, and they cannot.
And that makes the urgency and urge bladder.
It's very irritating, very irritating.
Yes, psychologically.
And exactly, and stressful as well.
Stressful.
Now, part of your description just a while ago, you mentioned the two words inflammation and enlargement. And now a lot of people, they don't know what's the difference or how to difference between that. Can you explain to...
The difference is that the inflammation of the prostate is an acute prostate enlargement.
Okay.
Okay, due to inflammation, due to different bacterial infection, the prostate can suddenly, in a very short time, within days, can be enlarged and has the symptoms as same as an older man with the big prostate, which is chronic.
Yes.
Okay, and we try to treat it with medications, which opens the gangs of the prostate, and antibiotic, and
anti-inflammatory,
and so on. And within days, there are a big relief.
Okay.
So it's an acute process.
Okay.
Sometimes the acute, after it's finished, maybe a young man will have the symptoms irritating him for a few weeks. So here we try to explain exactly to a young man, do not be annoyed. You are well treated, but still you will have some symptoms in your scrotum, in miction, slight urgency, and so on. Try to drink water well, continue to have fluid very well, and it's a matter of time that you get better. So that's an acute process.
Yes.
But prostate enlargement as the tissue of the prostate, which is something which comes with the age, that's nothing that you can treat it with antibiotic. It's medications, alpha blockers, we call them. It's a very good medication, very effective medication. But again, the medication can help to a certain size of enlargement. When it's over the size,
the normal size,
so even then we have to take the assistance of any kind of transurethral resection or reducing the size, which those days we are very well equipped with very good equipments, very minimal invasive that can reduce and shrink the prostate.
Exactly, and plus the other factors with the patient's age and the medical history. I still got more questions, but we have to take a short break. We're gonna watch a report and we'll be right back.
Great.
Stay with us. Welcome back. We're still talking in the studio to Dr. Ali Mehdizadeh. Dr. Ali, before the break, we were talking about prostate enlargement and prostate cancer. Now, we also touched on the signs and symptoms very lightly. What kinds of urinary problems or changes in the urinations could indicate a prostate issue? Because as you know, not everything could lead to a prostate issue.
See, there are a lot of similarities between the symptoms, but a urologist is a person who can divide and see exactly which one is due to prostate and which one is not due to prostate. So what we do, for sure, if somebody comes with any kind of such symptoms in urination, we do urine test to see if there is any infection, blood in the urine, protein in the urine. Then we have to do ultrasound we have different tools of ultrasound to check the size of the prostate, the bladder, and how the bladder is functioning regarding the muscles of the bladder, the capacity of the bladder. And a person we ask to come with full bladder to urinate in so-called Euroflow machine. It's a special toilet that we can measure the pressure of the urine.
So the flow rate of the
exactly.
urine, basically.
And we see if the flow rate is very well, so the problem is not, maybe is not from the prostate.
Okay.
So the patient could have a very normal UTI infection, or have a secondary or primary problem in bladder. Maybe it's bladder stone and it's not related to prostate. So with ultrasound, urine, PSA, and the very simple uroflowmetry, we can decide which way goes the problem.
Yeah.
And maybe we need to do some more investigations, but at the end we can find out if it is really from the prostate or it's some other issues, because sometimes the kidney stone, urethral stones, bladder stone, they do exactly the same symptoms. They do urge, urgency, and difficulty in the urination, because the any stone,
it's basically blockage.
Exactly. It's a blockage.
What are the recommended screening tests for prostate health, and what the age should men start doing them?
So if we are talking about the prostate screening, we start from 45 and above. Okay, if we are talking about tissue enlargement, prostate enlargement. So normally 45, some countries they start from 50 and above. It depends on the Ministry of Health of each country, their regulations, but normally is either 45 or 50, and it's PSA, urine routine, and ultrasound. Okay, so 3 factors are very important. We add here in Kuwait uroflowmetry, so we check also the urine pressure, because there we can find any stricture, any other problems also. So with this screening, almost you can detect over 80–90% of the problematic, if there is any.
Okay, I'm gonna try to cover as many treatment options with you. I know we don't have much time, but I want to go by the evolution of the treatment, because God knows that treatment for prostate came a long way.
Yes.
Okay. What are the current ways to treat prostate problems in terms of medication, surgery, or any newer techniques like the PVP?
Yes.
I will allow you to explain to our viewers what's that.
Let's make it very simple for our viewers. The first line of treatment is always medication. Okay. So there are a very good number of medications which we give and relieve the prostate. It opens the prostate and make the mixture very easy, and the person can have a very good quality of life with medication. So that's our first line. The second line, if the prostate is really large, now these days, in the last 5 years, we have something called the resume, that we go with vaporization, with some high level of water to increase it takes few minutes. With resume, you just insert a very small, tiny instrument in the urethra of the man, and you go to the prostate and you give 4, 5, 6 spots of 70 to 80 degree of water only, okay? And within 3 months, the prostate will shrink, because through this temperature, the prostate will start shrinking within 90 days, 100 days. It's a very nice way. It's without surgery, without any bleeding, without anything, and it's for certain patients, not for everybody. The size of the prostate is important to be less than 70 grams, and for younger people, which they don't want to have retrograde ejaculation, so resume is a very fine way. We have a lot of holmium, laser, different laser types. I don't want to go in details, but We have the golden standard, that's transurethral resection of the prostate, that we take in the middle of the prostate a certain part, and the flow becomes very well and stands very well. That's still the golden standard, but in these days we have very good way of different lasers that's very safe, fast. All of these interventions is endoscopically and takes less than 1 hour, 30 to 40 minutes.
And it could be done under local anesthesia.
Local anesthesia or other short anesthesia.
Yep.
And the patient can go home within 1 day or same day.
So it's a one-day procedure.
Yes.
I want to ask you about a term that we heard while we are preparing for this episode. Some mentioned like the peeling of the prostate. It's like an orange.
Yes.
Sometimes, you know, some of the urologists tend to explain it to the patients as like an orange and peeling the orange.
Correct.
Can you elaborate more on that?
Yeah, we go with the instrument through the urethra. Okay, as you know, the prostate is before a bladder.
Yeah.
So, and the prostate, if it's enlarged as same as an orange, so you go inside and you peel certain amount in the middle of and you keep around
the surface. Yeah,
so you don't
outer
touch,
surface will be intact.
Exactly. You don't remove the prostate.
Okay.
You just decline the size of the prostate from inside, in the middle, and that's where you goes to the bladder. So the flow of your urine, and there is no obstacle anymore. So you open the gate, if you want to see it like this. So you open the gate, and the urine flow goes easily, very fine, without any mechanical compression.
Yes.
Okay, and you have to see the patients. The patients, just 10 days, 2 weeks after this surgery, they change dramatically 180 degrees. Their quality of life is nothing to compare. And most of the people, they will tell me that I remember my youth.
Wow.
How I was going to the bathroom. So it's a big change. It's really a quality of life in the sense of we mean it.
Dr. Alizadeh, thank you so much for all the information that you shared with us and for your time. And unfortunately, that's all the time we have. We will be honored to have you again in Medical Talk in the near future.
Thank you very much for you and your team. It was a pleasure to be with you tonight and having this very nice session. So at the end, what I can really emphasize for any man, that check, if you have any mixture problem, don't delay it, check it. It's better than leaving it.
Exactly. Awareness is the most important thing.
Thanks a lot.
Thank you so much.
Thank you.
Dear viewers, stay with us. We'll be right back.
Hello everyone. Today our report is for all the mothers and the children that go to school. I know the lunchbox can be a big task for a lot of mothers, and so here we're trying to make it easy for you, and we'll be providing you with some tips to help you with what to put inside the lunchbox. Now, I always recommend getting a lunchbox that has many compartments in it. This way you can divide the fruits and vegetables and other food items, and it's easy for your child to see. Now, I always recommend that you have one fruit choice. I know sometimes it's difficult, but things like grapes are very easy to put inside the lunchbox. Blackberries and all different sources of berries provide a lot of nutrients for your child, as well as, you know, water, which is really important for them throughout the school day. Things like tangerines, apples, and peaches all provide lots of fruit, vitamins and minerals. And I always advise that you choose seasonal fruits when you're trying to put something inside the lunchbox. And then when it comes time to the carbohydrates, I know a lot of you, try to shy away from carbohydrates, but they're not all bad. Try to focus on things that are whole grain, like whole wheats, multi-cereal toasts. These are excellent sources for your children. They contain a lot of fiber. They'll keep them full throughout the day without the spikes in the blood sugar and not affecting their mood. And of course, let's not forget the importance of protein in every single lunchbox. Now, the good thing about protein is that it does keep them full. It will keep your children focused, and it's really important for them when they're running around and playing in the playground and building muscle. Things like cheese are excellent sources of protein. If you don't want to put it inside a sandwich, you can always get these individual portion cheeses, easy to put inside the lunchbox. Even the cheese cubes are nice to put inside the lunchbox. If your child doesn't like cheese as a source of protein, things like like baked chicken nuggets or fish fingers are excellent sources of protein. And if you bake them, then you don't need to worry about the calories, and they'll provide them with energy throughout the day. Now, let's not forget that other fruits and vegetables, like for example, dates, can easily go inside the lunchbox. They don't get mushy. They provide your child with potassium, all these nutrients that your child needs throughout the day. Now, we hope you enjoyed this report, and I hope it helped you out with your lunchboxes for the rest of the year. Thank you.
Hello, I am Dr. Fardin Khaji, urologist from Jarala German Specialized Clinic. Today, I would like to invite you to join us in the screening program in the November 2025 for prostate checkup. Our program is starting with an interview with the doctors. After inquiry about your health condition, we are going to perform kidney and bladder with prostate ultrasound. The procedure is very simple. It takes a few minutes, and by this procedure, we can evaluate your prostate as a sonography imaging. Then the patient or attending people, they prepare for second procedure is uroflowmetry. They should come with a full bladder, and they will check their urine stream. By uroflowmetry, we can see if there is any obstacles or any obstruction in the passing urine, and if the people is suffering from this issue or not, or they want to take some medicine, or we should to obtain them some treatment. In the end, after these things, the most important thing is a blood test, which is taking about 10 cc blood from the veins. It's taking only a few minutes, less than 10 minutes. And by this test, we can find if the tumor marker is high or not. The tumor marker is called PSA, or prostatic specific antigen. It's one of important markers for screening prostate cancer. As we know, the prostate cancer is a global issue for all the men healthcare above 60 years old. And we are going to fund this program in our unit. You can join us and be part of this program. Thank you. I wish you all the best in your life.